G'day everyone, Chris Fawcett from the Headache and Pain Management Centre here, and today just sneaking to the back of the clinic here to talk about a few little things, because basically a question that keeps getting asked towards me is, what role do my muscles play in my back pain? So most people that come to see us have had physio, chiro, osteo before, they've been to Pilates or yoga, but they haven't actually had a really good explanation of how the muscles can cause back pain in the first place. A lot of people make the mistake of actually thinking it's their muscles. Like they might have heard the phrase transversus abdominis before, which is a muscle that's one of your abdominals. Unfortunately though, the transversus abdominis actually lays right over the top of your bowel, so it's actually just under your skin, and maybe a little bit of the spare tire if you've got one there as well. The muscles that we need to look at are the psoas, which are at the front of the spine, and the multifidus, which are at the back of the spine. Those two muscles are the main stabilisers, and if you haven't had those assessed or treated before, it means that you're probably not going to get best results. Now, when it comes to low back pain, effectively when you get pain of any type, of any muscle anywhere, what happens is that the muscle starts to switch off. Okay, so as a protective mechanism, your brain actually switches the muscle off, and we call that inhibited. Okay, so they become inhibited. Now, because those muscles don't work, they're not doing as much as they used to, they become weak. Okay, so that means that you're trying to ask your muscles to do things that they used to do before, they're not working quite as well, and it just feels kind of weak, kind of unsteady, kind of unstable. Now, the third thing that happens after your muscles get weak is that it becomes stiff. So the way that your body protects your muscles from actually, doing any damage to itself is to stiffen all the joints and muscles around it so you can keep going. Now the problem is that pain then comes from the stiffness. So you've got the first bit, which is the pain which came from the initial injury or the initial insult, and then it becomes inhibited, it becomes weak, and then it becomes stiff, and then you get more pain. Then it becomes inhibited again, it's weak and gets stiff. So I can understand if you're not dealing with the muscles properly right from the very beginning, that you're not going to get the results that you need. And you've got to make sure that the muscles are the ones that actually need to be treated, not the ones that they just think should be treated. And the way to work that out, you need to assess it, you need to treat it properly, you need a treatment plan very early. Basically the way that we would treat that is to get the muscles loose and moving as best we can, and also get it strong as we can, as fast as we can. I hope that's been helpful, and we'll see you next time for the next video. Cheers.